Good morning.
Morning.
I'm Louis Morris, Chief Counsel to the Inspector General for the U.S. Department of Health and Human Services. Thank you for the opportunity to testify about new tools in the recently enacted Patient Protection and Affordable Care Act that will help combat waste, fraud, and abuse in the nation's healthcare system. OIG has been leading the fight against healthcare fraud for more than 30 years. Between 1997 through 2009, audits and investigations returned $15.6 billion to the federal government. OIG and DOJ's combined efforts returned more than $4 for every $1 invested in the fight against healthcare fraud. Despite our successes, there's more to be done. Those intent on breaking the law are becoming more sophisticated and the schemes more difficult to detect. The fraud is migratory and adaptive. Criminals quickly modify their schemes in response to our enforcement efforts. That's why law enforcement must collaborate and make use of cutting-edge investigative tools to keep one step ahead of the criminals. Innovative uses of information technology, combined with access to data, are at the heart of that strategy. For example, technology enables OIG to quickly review voluminous electronic evidence obtained during the course of our investigations. Cutting-edge software allows investigators to complete in a matter of days analysis that used to take months with traditional investigative tools. Data analysis also helps us to be proactive. For example, a joint OIG-DOJ data team combines data analytics with field intelligence to identify fraud hotspots. We use that analysis to deploy the Medicare fraud strike forces, teams that include special agents from OIG and FBI, DOJ prosecutors, and often state and local law enforcement. Action is eloquence. As of May 31st, strike force efforts nationwide have charged over 550 defendants, obtained over 300 convictions, and secured over $260 million in court-ordered restitutions, fines, and penalties. To further improve our effectiveness, we are working to develop a consolidated data analyst center, which will integrate business intelligence tools and data analytics to enhance our fraud detection efforts. It will also provide the opportunity to analyze and share data consistent with applicable privacy, security, and disclosure requirements with our law enforcement partners. This is a big job. It requires a team effort. While we are accomplishing a great deal, the Affordability Care Act gives us new authority, additional resources, and the tools critical to our success. Criminals who commit healthcare fraud will be caught earlier, cut off from Medicare faster, and serve longer prison terms. My written testimony describes more fully how the Act will help us spot an illegal scheme before it gains a foothold and more accurately predict the next move of the criminals. Highlights include the following. The Act gives law enforcement access to claims and payment data. We are striving to get this data in real time, as soon as it is submitted to Medicare. This gives us flexibility and speed, especially important in catching criminals who often shift locations and schemes to avoid detection. Nursing facilities are required to report ownership and control relationships. This makes it easier to establish accountability and legal responsibility for the quality of care provided to residents. The new disclosure requirements will help put an end to corporate owners owning substandard care in their homes while denying responsibility and leaving unfunded shell companies to take the blame. Manufacturers of drug, device, and medical supplies will be required to report payments to doctors and teaching hospitals. The types of payments subject to disclosure have been implicated in illegal kickback schemes. The public disclosure of these payments will help the government and the public monitor industry-physician relationships and may deter kickbacks. Ensuring the integrity of information is also critical, and the Affordable Care Act provides new accountability measures. For example, OIG is authorized to exclude from the federal health care programs anyone that provides false information on any application to enroll or participate in our programs. Finally, the Affordable Care Act provides critical new funding, $350 million over the next 10 years, that will enable OIG and its partners to expand and strengthen our program integrity efforts. On behalf of the Office of Inspector General, thank you for the tools and resources that will allow us to better protect these critical programs and their beneficiaries. I'd be happy to answer any questions you may have.